Benefit risk management. Welcome to our presentation on benefit risk management. Today, we'll be exploring the crucial aspects of managing the balance between the benefits and risks of medicinal products. This is an essential component of pharmacovigilance, ensuring that medicinal products continue to offer more benefits than risks throughout their life cycle. We'll cover various processes, including crisis management, urgent safety restrictions, safety communications, and more, providing you with a comprehensive understanding of how these elements contribute to effective benefit risk management. Disclaimer. Before we dive into the content, it's important to note the disclaimer. The material presented here is copyrighted by Next PV Services, SRO, and represents the views of the creator. Our team uses AI to enhance the presentation, but the responsibility for accuracy, relevance, and integrity rests with our human experts. This blend ensures we deliver high-quality and informative content. Please keep this in mind as we proceed. Content. This slide outlines the structure of our discussion. We'll begin with abbreviations commonly used in pharmacovigilance and benefit risk management, followed by background information on benefit risk assessment. We'll then delve into specific PV processes involved in benefit risk management, including crisis management, urgent safety restrictions, safety communication, and safety variations. We'll also discuss referrals and additional monitoring processes to give you a full picture of how these mechanisms work together to maintain the safety and efficacy of medicinal products. Abbreviations. Understanding the abbreviations is crucial for navigating the field of pharmacovigilance. Terms like ACO, Addendum to the Clinical Overview, CA, Competent Authority, CHMP, Committee for Medicinal Products for Human Use, and others are frequently used. For example, GVP stands for Good Vigilance Practice, which provides guidelines for pharmacovigilance activities. The MA, Marketing Authorization, and MAH, Marketing Authorization Holder, are central to regulatory processes. Knowing these abbreviations helps in understanding reports, regulatory documents, and communications within the industry. Background benefit risk assessment is a cornerstone of pharmacovigilance. After a marketing authorization is granted, continuous evaluation of the benefits and risks in actual use or long-term use is necessary to ensure the benefit-risk balance remains favorable. This ongoing assessment is documented in aggregated reports like PSURs, Periodic Safety Update Reports, and ACOs, which summarize safety and efficacy information over defined periods. These reports focus on evaluating the benefits relative to risks associated with drug use, ensuring that patient safety is always a priority. PV processes in BR management. Benefit risk management involves several pharmacovigilance processes. Signal management, which is covered in a separate presentation, identifies new safety information that could impact the benefit risk balance. Crisis management deals with urgent issues requiring immediate action. Urgent safety restrictions are implemented when serious safety signals are identified. Safety communication disseminates new or emerging safety information. Safety variations address changes needed in the marketing authorization. Referrals involve regulatory procedures to resolve safety concerns, and additional risk minimization measures ensure ongoing patient safety. Each of these processes plays a vital role in maintaining a favorable benefit-risk balance. Crisis management. A PV crisis occurs when new information about a medicinal product could seriously impact public health, necessitating immediate action. Examples include unexpected clinical data, tampering or quality issues, product recalls, regulatory actions, or adverse media coverage. When a potential crisis is identified, it should be immediately reported to senior staff, who will escalate it to the head of the PV department and the EU QPPV. Effective crisis management ensures rapid response and resolution, minimizing potential harm to patients and maintaining public trust in the medicinal product. Urgent safety restriction. Urgent safety restrictions, USRs, are triggered by validated safety signals that may have a serious impact on public health. The decision to implement a provisional USR can be made by the EU QPPV, the marketing authorization holder, the client, or the competent authority. USRs are identified during continuous benefit-risk assessments, including signal management. This process ensures that necessary actions are taken promptly to protect public health, highlighting the importance of vigilant and proactive pharmacovigilance practices. Safety communication. According to GVP Module 15, safety communication involves the dissemination of new or emerging safety information. This includes information about previously known or unknown risks that could impact a medicine's benefit-risk balance and its conditions of use. The primary aim is to provide timely, evidence-based information on the safe and effective use of medicines. This helps facilitate changes in healthcare practices, supports risk minimization behaviors, and enables informed decisions regarding the rational use of medicines. Effective safety communication is essential for maintaining transparency and public trust. Safety variations. Safety variations are changes to a medicinal product that may significantly impact its quality, safety, or efficacy. These variations, such as changes to the SMPC, Summary of Product Characteristics, and PIL, Patient Information Leaflet, dosage modifications, or changes in target populations, often arise from benefit-risk monitoring, including signal management. They can also be prompted by directives from the EMA or competent authorities, risk management plans, or post-authorization clinical programs. As the marketing authorization holder, referrals. Referrals are initiated to address safety concerns or disagreements among member states regarding the use of a medicine. Safety-related referrals are assessed by the Pharmacovigilance Risk Assessment Committee, PRAC, and subsequently by the CHMP or CMDH. Other referrals may be assessed solely by the CHMP. Referrals can be initiated by the European Commission, any member state, or the marketing authorization holder. The EMA conducts scientific assessments of the medicine, or class of medicines, in question, ensuring a thorough review to resolve the issues. Referrals. Different types of referrals address various safety and regulatory concerns. Article 107I procedures, known as urgent union procedures, are initiated by the European Commission or member states when urgent action is needed due to safety issues. Article 20 procedures deal with manufacturing or safety issues specific to centralized procedure products. Article 31 referrals address concerns about the quality, safety, or efficacy of medicines. Pediatric medicine issues are handled under Article 29. Articles 13 and 29(4) deal with disagreements among member states regarding variations and serious public health risks. Article 30 referrals aim to harmonize decisions across the EU, addressing divergent decisions among member states. Additional monitoring. Post-marketing surveillance is essential for identifying risks that were not evident at the time of initial approval. Some medicinal products require additional monitoring to ensure their benefits continue to outweigh their risks. These medicines are marked with an inverted black triangle in the SMPC and package leaflet. The PRAC publishes and reviews a list of these medicines monthly. Typically, a medicine remains on the additional monitoring list for 5 years, but it can be removed earlier if deemed low risk by a PRAC review. This process ensures ongoing vigilance and patient safety. Additional monitoring medicines subject to additional monitoring include new active substances authorized after January 1, 2011, biological medicines such as vaccines or blood-based products, conditionally approved medicines, and those approved under exceptional circumstances. These medicines require further studies to gather data on long-term use. The list of medicines under additional monitoring is publicly available and regularly updated. This transparency allows healthcare professionals and patients to stay informed about the medicines they use, fostering trust and ensuring safe and effective treatment options. Thank you for your attention. As we wrap up this presentation, I want to thank you for your attention and engagement. The effective management of benefit-risk balance in pharmacovigilance is vital for patient safety and the success of medicinal products. Should you have any further questions or require additional information, please feel free to contact NextPV. We are committed to not just fulfilling tasks, but to supporting and taking care of our clients with the highest standards of professionalism and expertise.